Good morning, guys. A little bit earlier today, and it's TGIF. Happy Friday. But I guess every day is kind of Friday these days. We are in the office today with Dr. Salemy, and we are talking about lipo, fat transfers, and Brazilian butt lifts.
How's it going, guys? Hope everyone is doing well. It's a beautiful day in Seattle today. I want to apologize in advance if I start rubbing my eyes. I'm kind of dealing with some allergy things right now, so sorry about that. Hope everyone's enjoying themselves. Yes, as Olivia said, got through another week. Feels like things are looking up, knock on wood, both for Seattle as well as the nation in general. And we'll get through this together. I think we're going to do just fine on the other end of this. We wanted to talk about liposuction today. Probably one of the most common things we do, because we often are doing it not just in and of itself, so someone coming in saying, hey, I want a little lipo of my tummy or abdomen, but also combining with other procedures. It's really common to combine with other procedures. So we want to talk about how do we pick a patient that's going to do well with liposuction, and then let's also talk about fat transfer and kind of the common areas that we do fat transfer, and then we'll answer a bunch of questions. What's liposuction? Liposuction is a procedure that's designed to contour localized deposits or areas of fat that are stubborn and not responsive to diet and exercise and are out of balance with the surrounding areas. It's not designed for weight loss or as a weight loss option. So for example, somebody who, let's say, has a little excess fat on their hips or on their outer thighs, they do great with liposuction. But if someone came in and said, you know, my entire thigh, both my upper thighs are really heavy, I want my entire thigh liposuction, that's a trickier thing. It's not as reproducible in terms of getting a good result, and those are patients we try to talk to maybe other options and not surgery for that. The way the procedure works is that we make a couple of small incisions over each area of fat. We put a fluid into that fat. It's called tumescent solution. Tumesce just means to stretch, and a tumescent solution consists of usually of three things: saline or salt water, epinephrine, which is a medication to help with bruising, and lidocaine, a medication to help with discomfort. And we infiltrate that fat with that solution. We wait a few minutes for the medications to work. And then we personally use what's called power-assisted liposuction, which is probably the most common form of liposuction used today. And what that is, it's a long metal cannula. It's got a few holes on the end of it. And the cannula is attached to a suction device. And the end of the cannula, the hand piece, vibrates. So as we're going through, it's breaking up any fat or any fibrous connections, and it really helps us get a nice, smooth, even result. We stop the procedure when we feel like we've gotten the contour we want. So the goal isn't to remove every last bit of fat. That's just not possible. The goal is to get the contour right, and then the key thing is to allow the skin to tighten over that area. So how do we know if someone's going to get a good result or not? So if you imagine two patients, one patient, let's say, has excellent skin quality. It's on a part of their body that has thick skin in general. So, for example, the abdomen, the flanks, the back, the outer thigh. They have a small amount of fat, and this to allow the skin to sit down evenly over it. Those patients are going to do really well. But on the other end of the spectrum, imagine a patient who, let's say, has maybe had has some loose hanging skin, some stretch marks in that area, maybe after having a pregnancy or something like that on their abdomen, and has a lot of excess fat, a lot of loose skin. They're probably not going to do very well with a liposuction, because the skin is not going to be able to sit down evenly. And instead of getting a nice, smooth, even result, they're going to get a lot of lumpiness and waviness. So part of our job as plastic surgeons is to help patients understand if they should be expecting a good result, or if maybe we should be talking about something else. And you'll hear me say this probably more than once today. This is one of those procedures that seems really straightforward and simple compared to a lot of things that we do, but it's as important as any other procedure in terms of making sure you're going to a board-certified plastic surgeon, someone who really has the training and the qualifications to do this, because this procedure could easily cause a lot of problems for patients. Now, sometimes when we're doing liposuction, we're just trying to get out that excess fat. We don't really care about the fat that we remove. All we're thinking about is how is that area going to look when we're done. But for other patients, they want us to do something with that fat, and that's what's called a fat transfer. The most common areas that we do a fat transfer are the buttock, BBL or Brazilian butt lift, the breast, to do an augmentation without an implant and fat transfer, or in addition to an implant and fat transfer, or to the face. Those are the three most common areas I do. So when we're doing a fat transfer, our goal is twofold. It's to make the area that we remove the fat from look as nice as possible, but also to keep those fat cells viable and to transfer them to a different area to make that area look as nice as possible. So in between those two steps, where we're doing the tumescent solution and we're doing the fat removal, we're actually doing a fat harvest. And what that is we're removing excess fat, but we're doing it with a slightly different technique with less trauma to the fat, less suction pressure, less vibration. And we're running that fat through some type of system to clear any fluids or oil from the fat, whether it's a filter or a washing system. So then we have your own really good fat to transfer. I also believe that it's nice to prevent that fat from having any contact with air. So the way that the systems that we use for transferring are what are called closed systems. So the fat comes out, it's transferred into syringes after it's washed, and then it's symmetrically injected into the areas that we want to augment. I think that helps with the viability. And then after we transfer the fat, and I'll talk about how we do that in a minute, we go back over those donor sites, the areas that we took the fat from, and with our regular power liposuction to get the smoothest possible contour of the donor site. In terms of how we transfer it, we want to transfer it symmetrically and evenly into each area, and there's a lot of different techniques for that. The BBL, the Brazilian butt lift, that's one of those operations that it's very important that it's done properly and safely, because there's very good data now that says if the fat is transferred too deep, if it's transferred underneath the muscles of the buttock instead of in front, superficial to it, patients have a higher risk of having complications like emboli. Fat embolism is what we really worry about. So once again, really important to go to a surgeon that understands that risk, that is board certified in plastic surgery, and knows how to deal with that. So that operation can yield beautiful results. We posted a photo earlier this week on our Instagram to show the kind of aesthetic that we like, the kind of nice natural fullness. But it can give a great result. We also use that fat transfer a lot for the mid-face, for the cheeks, as part of a facelift. Really common now to do it. Women absolutely love that approach. And finally, a lot of patients will come to us who want a little bit more fullness to their breast, but don't really want an implant or maybe not quite ready for one. What's nice about fat transfer is we can transfer it symmetrically into each area of the breast that we want. So for example, if the breast shape is overall quite good and patients just want a little more fullness in the upper portion, that's an advantage that fat transfer gives you versus an implant, because we can target where we put the fat. So lots of great options for fat transfer and liposuction, really popular operations, and do them pretty much every week in our office. I hope that makes sense. I was going to maybe start out with some, should I do some of the questions here? Okay. So let's see. First question's from Vixavan? I don't know if I got that right, sorry. Can you lipo fat from the legs for BBL? Yeah, absolutely. The most common areas we take fat for BBL are the abdomen, the flanks, outer and inner thighs. Definitely most common areas. And then can we do I think it's just from Tree Ats saying, can you do it for hip dips? I think what they're asking is, can we transfer fat into those depressions? We can. It depends on how deep it is. An important thing, and this is actually a good point, with fat transfer, no matter how we treat the fat and no matter how we transfer it, there's going to be a percentage of fat that's going to be absorbed over time. Those studies say anything from 30, 40%, even as high as 50%. So we need to overcorrect that a little bit, and especially if it's a really concave area, we should be at least discussing the possibility of needing to do more than one fat transfer. But it can be done in those areas. Cassie Taylor is asking me, how much fat do you typically transfer for BBL? It's a good question. It varies depending on how much fat the patient has and how much of a difference they want. In our practice, and I don't know if this is true for the entire Northwest, but certainly in our practice, patients are usually coming to us wanting a more modest change. So we're typically transferring 300 per side, 350 per side, sometimes a bit more, sometimes a bit less, but it's about that. I have a question also from Cassie saying that she's in her mid-20s with no kids. She's got an extra 15 to 20 pounds of stubborn belly fat. Is lipo an option? Well, so it goes back to our question. What does the abdomen look like? Do we think we can liposuction it but still give you a nice, even, smooth result? There's no question we can liposuction a lot of fat from different areas, but that doesn't necessarily leave that area looking better. We want it to look better. So that means making sure we're picking the right patient for it. So this is one of those things where we have to really examine the patient. If the skin quality is great, there's a small layer of fat, patients are going to do very well. If the skin quality is loose and you can tell if it's kind of hanging and you have a lot of extra fat in there, we either need to do a very conservative liposuction, so we're not going to leave you with any loose skin. Excuse me, my eyes are hurting. Or we should maybe not do the liposuction.
Kind of piggybacking off this one, someone asked earlier, from what age would you recommend to do liposuction?
I mean, I've had patients as young as 18 coming in for liposuction and older in their 60s or 70s. It really depends more on the quality of the skin, the location, and the amount of fat. If the skin quality is good, whether you're 18 or 60, 70, that's not as important. What matters is, do we think we can get a good result? Typically for something like this, I wouldn't recommend doing it until you're 18, but that would be the earliest.
Can you donate fat to someone else?
No, you cannot do that. It'd be like donating an organ to somebody else. There's rejection, and no, don't do that. I hear that a lot from like couples. The husband will come in and say, well, I got a lot of extra fat. Can I give her some? And the answer is a hard no. So let's see. Now, I have a question from ThirstCon asking, how do you do this dangerous procedure safely? And I think they're talking about BBLs. What I would say is that a BBL is actually a pretty safe procedure if you understand how to do it and what the safe plane is. As we were talking about, we want to layer that fat between the skin and the muscle, not deep to the muscle. Most surgeons who do this regularly can understand that and know where that plane should be. The danger is when surgeons who don't understand that anatomy or aren't doing it regularly or even trying, some surgeons are even trying to put it deep into the muscle because they think they'll get a better result that way. That's how you get into trouble. That's the risk of the operation. So we, just having done this a long time, we know that layer that we're going for, and we're trying to create a really nice, modest result. We're not trying to overdo it. And we've been, thankfully, really had great results with it. There's a question about cellulite from Jamie Marquardt. We hear this question all the time. I don't have any surgical options that are going to really dramatically change cellulite. I know there's some non-surgical treatments out there that some folks think help a lot, but liposuction is not going to change cellulite. It's going to really have to be some other type of approach.
Audrey on here is asking if we are an essential business and if we're open for surgeries.
Great question. I would say we are not an essential business. We're doing virtual consults and doing content like this just to help educate patients, and if patients want to do a virtual consult, we're doing a lot of those. Our office, just like every other plastic surgeon's office and a lot of different offices, like even orthopedic surgeons, eye doctors, dermatologists, dentists, unless it's an emergency, we're mandated by the state to not perform any elective surgeries right now. And I think it's the right choice. We're trying to do our part to flatten the curve, protect our PPE supplies, to make sure we have enough supplies for the hospital workers. So we're not operating right now. As far as we know, we'll be able to starting May 18th. That's what we've been told by the state. So hopefully that date will hold, and we'll be ready to go when that day comes.
This is a men's lipo question.
Yeah.
Is there a certain amount of weight that they should lose or they're required to lose for lipo?
Yeah. I don't have a hard number for any particular patient. It really depends on the exam. But one thing that's very important for men to understand is the difference between the fat that we can liposuction and what's called visceral fat. We talked a little about this last week when we were talking about tummy tucks, but if you're looking at a cross-section of the abdomen, you have the skin, you have the layer of fat that we can liposuction, you have your muscles, and then behind your muscles you have your intra-abdominal contents, your organs, and fat around that area. Oftentimes not always, but oftentimes when men are kind of heavier in their abdomen, they're carrying a lot of that weight in their visceral fat. That is not an area that can be addressed with surgery. That's diet and exercise. So when we examine them, what I'm trying to do is tell them, look, this is the area we can go after, this is the area we can't. Some men, it's mostly visceral fat, in which case, no surgery. Other men, it's that layer between the skin and the muscle that we can contour. So it really depends on the patient and what their exam is like.
And I have another question from Jennifer about price and specific to how much she weighs. Is the price relevant to?
Oh, good question. No, we don't base our pricing on the patient's weight. No, it depends on the operation we're doing. Sometimes it may take longer for a certain patient, depending on it, but it's not based on weight. That's a good question, though.
Can you do tummy tuck, lipo, fat transfer, and BBL at the same time?
Yeah, we can do that.
Not simultaneously, but...
it takes me a few hours, but no, we can do that. And that's actually often a really good combination because some of the fat that we want for the BBL is coming from that abdominal skin and fat that we're excising as part of the tummy tuck, so we don't want to waste that. So yeah, we do that pretty regularly. It can absolutely be done. Did I catch all those?
Yep.
Okay, cool. Let's see. Let's talk about sorry, that's another phone next door. I'll just close that.
Yep.
So let's see. Let's talk about what are the risks of the fat. This is from Joanna, saying what are the risks of over time of the fat settling and redistributing. So that's a good question. So over time, fat, when we transfer fat, I haven't seen it in my personal experience that patients come in years later with fat and funny spots or anything like that. We tend to encourage folks to stay at or near their goal weight. That's important. If folks lose or gain a ton of weight, you're going to see differences. Whether or not you do liposuction, you're still going to see some differences. Usually once you get out to about 6 months or so after a fat transfer, then you're kind of where you're going to be. That tends to be where patients are in terms of their final result. Any fat that's going to be absorbed has been absorbed. But I haven't seen a lot of redistribution. I would imagine if someone had, let's say, liposuction on one area of the body and then they gained 50, 60 pounds, they're going to gain that weight somewhere. They're going to gain it in wherever they have fat cells. So that can be where we took some fat from and they still have some fat cells there, or in other places. So regardless of that, it's always going to be important to stay at or near your goal weight if possible.
A question from Rosie.
Yeah.
Crepe skin, CREPE.
Okay.
Don't know what that is.
Oh, crepey skin.
Yeah. What can you do for that?
Yeah, so crepey skin can't be dealt with liposuction. That's usually going to be removal of the skin. So that's going to be things like, for example, it's on the abdomen, it's going to be a tummy tuck. It's going to be, whenever we're dealing with skin issues, we want to remove the skin. And that's going to be tummy tuck, or let's say it's on the arm, we're talking about an arm lift. If it's on the flank, we're talking about a flank lift or a lower body lift. Let's see. I got another question from Thirst Khan asking, do we have any BBL deaths? No, thank God. That would be pretty awful for everyone involved in that. No, we don't. But I think part of it is that we try everything we can to put safety first. So what does that mean? It means, and this actually dovetails nicely to what we're going to do next week. Next week, we're going to do a tour of the office, and we're going to go through some of the things that we've done to make our office as safe and as nice as possible for our staff. But part of it is doing it in a properly accredited facility, proper sterile technique, properly trained anesthesiologists, properly trained nurses. As a surgeon, doing these operations regularly, conservatively, carefully, that's important. So nobody has a crystal ball and can predict everything that can happen, but we try everything we can to make it as safe as possible for patients. What else can I answer for you guys? Where all can we take the fat from? That's a good question. So the most common place, like we're talking about, are abdomen, flanks, outer and inner thighs. Sometimes folks have some excess fat on their upper back. Like when we're doing a bra line back lift, they have some excess fat in there as well. Those are the most common areas that we will do. And I think I have most everything that I've been asked. Yeah, so great operation. There's a lot of photos on our website about, we have photos of liposuction, BBLs. If you look at our facelift photos, you'll see a lot of them include fat transfer to the midface, which is a really nice adjunct to a facelift, so take a look at that. But great operation. We're really excited to offer it to our patients, and hopefully in a few weeks we'll be operating again. Thanks for your time. Any other questions? Looks like we're we're good?
Rosie said thank you. Very thorough. Excellent presentation.
Thank you, Rosie. Well, great, guys. Next week we're going to be doing tour of the office. Yeah. We'll show you guys a virtual tour of our office and go through all the sort of safety precautions we take for our patients.
Thank you, guys.
Thanks. Bye.